It's one of the most beautiful bits of work people can ever do, because in this world, we know that symptoms are teleological. They point towards what you're not looking at. So if you use symptoms as entry points into a deeper inquiry, so I teach people how to listen to their cells.
Hi, everyone. Today's interview is extra special for me because it's personal for me. I know that anyone who has walked this path, this journey of chronic health conditions knows that there are key people, important people along the way that help you through your journey. And my guest today was absolutely one of those people for me. If you've been with me here for a while, once we get going, you're going to already know why my guest today was so important, because I've talked about him many times, but not just to me, to so many others that are facing chronic complex conditions. And if you're new here, welcome. My name is Raelan Agle, and my message is simple: that recovery from ME/CFS and long COVID and similar conditions is absolutely possible. And every week, I back that up with new interviews and the latest science that is showing us the way forward with these conditions. And this is such a surreal moment for me. My guest today is the incredible Dr. Bruce Hoffman. It would take me probably half an hour to list all his credentials and his achievements. So let me just share a couple highlights. Dr. Hoffman is an integrative and functional medicine doctor, and he serves as the medical director at the Hoffman Center for Integrative Medicine and the Brain Treatment Center of Alberta, specializing in complex medical conditions. He also holds a master's degree in clinical nutrition and is a certified functional medicine practitioner, certified shoemaker mold treatment protocol practitioner, Ayurvedic practitioner. He's firmly trained in the treatment of Lyme disease and co-infections, and co-authored a paper on mast cell activation syndrome. And beyond his clinical training, he's just studied with many of the leading mind-body spiritual leaders of our time, including Deepak Chopra, and so many more. So this expertise is exactly what he's bringing to this interview right now. Incredible. And I'm just so thrilled to be able to help share his work with you. But what makes this especially meaningful for me is that when I got ME/CFS after being dismissed by my GP and much of the conventional medical system, Dr. Hoffman was my doctor. He was the only doctor who supported me during my journey with CFS, truly believed that what I was facing was not only real, but also fixable. And for those first two really rough years of my journey with CFS, he was my absolute lifeline. And he always told me that while we didn't have all the answers yet, there was hope. And he taught me to take control of my healing journey. He's an incredible doctor, a wonderful human, and I'm just so excited to get to share a little bit of his work with you now. So please join me in welcoming Dr. Bruce Hoffman. Dr. Hoffman, this is so incredible to have you here. Thank you for doing this.
No problem. Pleasure.
Just before we hit record, we're trying to remember how long it's been, and it's been a good 15 years since I've seen you.
I didn't realize it was that long, but yes.
Either did I until you asked. I don't know what it's like from your end, but for me, there are so many reasons that working with you was so incredible and how much I appreciated you. But, I started out the traditional route, like a lot of people do who get conditions like chronic fatigue syndrome.
Right.
Started with my GP and just the conventional medical system around me. And I was just being dismissed and told straight out that there was nothing wrong with me, but I couldn't get out of bed. I couldn't go to work. They wouldn't even sign off for me to take a short-term disability leave because I was fine. So then I found you, and I remember our first session was long, detailed. You asked me so many questions, and you believed me, and you were like, we'll figure this out together. And it just, for those first 2 years that I was seeing you, I think it kept me alive. Without that support, I don't know how I would have gone through it. So just first off, thank you. And I just want you to know how much having you in my life then really made a difference.
Very good to hear. One of the great tragedies of our profession is this whole statement that's all in your head, so it's just so ubiquitous and so damaging for patients not to be seen and heard when they're suffering in a complex way. And when the traditional system doesn't have answers, to just instead of saying, I don't have an answer, but I believe you, they will often say, it's, I'll refer you to a psychiatrist. Take Paxil. Yeah, it's all in your head.
Which is not only frustrating and infuriating, but it's also terrifying because we're like,
Yeah, right.
if the doctor's not helping me, what am I supposed to do? I'm sicker than I've ever been, or I feel sicker, and now I have to figure this out all by myself.
Yeah,
So,
and that's why there's been, ever since I last saw you, which is long, there's been this explosion of patient advocacy, where patients just they know that they're not going to get help from the traditional, we call that system N squared, D squared, right? Name of symptom, name of drug. Name of symptom, name of drug. Oh, what's your symptom? Okay, Paxil, okay.
Oh my goodness.
And it's a 15-minute consult. There's no way you can get to the bottom of this complexity because people get sick over, even inherited issues, inherited traumas, early developmental traumas, early exposures, immune system dysregulation, food indiscretions, the mold exposures. It just builds and builds and builds and builds. And all the time, your mitochondria, since I spoke with you or worked with you, there's been a huge shift from, nuclear understanding of diseases to mitochondrial understanding. So we know like 95% of most chronic diseases are based on mitochondrial dysfunction. And if you can get to the bottom of what's going on at the mitochondrial level, you could often unravel the saga, the story.
So what is causing this mitochondrial dysfunction or whatever we call it, and how do you address that?
Well, there's a couple of big researchers out there right now. One's called Doug Wallace, and the other's called Robert Naviaux. And Robert Naviaux sort of put on the map this whole concept of mitochondrial dysfunction from what he called a cell danger response, right? So you've got 40 trillion cells, and each cell you've got between 200 and 2 million mitochondria. And mitochondria convert food to energy, but they also convert light, water, and magnetism to energy. In fact, 70% of mitochondrial energy is through light, water, and magnetism, only 30% from food. So we previously used to emphasize food to a large extent to change mitochondrial behavior, but now we're using a lot of biophysics, quantum biology, circadian biology principles to turn back the mitochondria into activity. And there's two major functions of mitochondria. One is energy production, ATP, but the second is sensing danger. So when the mitochondria sense that the toxic load is exceeding a homeostatic threshold, they go into this defensive mode, and they change their outer cell membrane, they change the voltage, they change their oxygen use, and all the metabolic machinery of the cell starts to unravel, and the patient becomes sick, and the mitochondria stop communicating with each other. And then you get this whole inflammatory cascade. The cell membrane gets damaged, the DNA gets damaged, the DNA releases its contents, energy, ATP, gets released outside the cell. That then triggers mast cell activation, which release another 1,200 mediators of inflammation. And all of a sudden, the cell is in a stuck defensive mode. And that's what causes many of these chronic diseases, is the cell, the mitochondria, in this stuck inflammatory response, which is adaptive. It's trying to get you to stop being exposed to the toxic load. So it's evolutionary. It's not in and of itself a problem. It's only a problem when it gets stuck in that response. So the trick is identify all the stresses that have led to the mitochondrial inflammatory response, reestablish all the principles of the health cycle, which is all the lifestyle things you need to do to get better, and then do your labs to find out what metabolic machineries become deranged, and then treat that.
And what are some of the key lifestyle changes that people find most helpful?
Yeah, there's a lot of them. I just lectured on Tuesday on this for 2 hours. So So, so we talk about the health cycle principles as the things that you need to do in order to kickstart ATP production, to get energy back online. And some of the most important things are following circadian biology principles, because every cell in your body has a gene, a clock gene, and your organs work according to day and night cycles. So some of the lifestyle factors are, number one, expose yourself to sun. It's huge. And this whole movement of sunscreen and sunglasses and staying in the shade is counterintuitive and bad for the mitochondria. You need to get sun exposure. So you need to get early morning sun as the sun rises over the horizon, which at present is 5:20. I know because I was up at 5:15 this morning. So you watch the sunrise and you get the early UVA, and then you want to watch the sunrise for an hour. And that then starts to kickstart melatonin production, starts to kickstart all your neurotransmitters, starts to kickstart all your hormones, it starts all your clock genes saying, oh, it's daytime, wake up. And then you want to get to the UVA, and then you want to get midday sun. You want to get UVB from midday, which is only here in Canada for 4 or 5 months of the year, you know. So we in 51-degree north latitude are very disadvantaged, particularly in the winter months. And most people get really sick in the winter months because they're not getting enough UVB and vitamin D. Vitamin D is a hormone that regulates the entire immune system. So you want to get up with the early morning sun. You want to expose yourself in the daytime to sun like UVB. You want to see at night, you want to get some of the sundowning effects of the infrared light. And then at night, you want to be mostly in darkness. You don't want to be switching on your overhead LED lights, watching TV and being on your screen all day. Those damage the mitochondria, like these 15 mechanisms why man-made electromagnetic fields are so damaging to the mitochondria. So the first thing is get outside, get exposed to sun, develop a solar callus, which is a brown skin. Don't burn, but slowly develop a brown skin over summer. Then at night, you want to be mostly in darkness. Ground by barefoot walking at least an hour a day, not with your rubber-soled shoes, but with barefoot on the earth. And the most important of all, we've subsequently learned, is to get out of non-native EMFs, the electromagnetic fields that are ubiquitous and which we surround ourselves with. And we wake up in the morning, look at our Instagram, we look at the blue light, we get on our computers, we indoors, we don't go outside, and we just get exposed to these non-native EMFs all through the day and night. And then we go to sleep at night. We got our cell phone next to our bed, which is, 2.4 gigahertz of energy being aimed at your brain, which idles at 8 to 12 hertz. Here you got 2.4 gigahertz bombarding your brain. Your Wi-Fi router's on. I mean, it's a mess. And people don't really tell the truth, and nobody's really telling the truth how toxic man-made non-native EMFs are. And so one of the greatest health cycle principles is weaving yourself back into the cycles of nature. You've got to become an outside type person, particularly in the summer when you've got to get as much sun as you can to fire up your mitochondria, because your mitochondria are really batteries, and they need sun, they need water, and they need magnetic fields from the Earth's magnetic field, which vibrates at certain frequency that resonates with your brain's idling frequency, the alpha brainwave, which is 8 to 12 hertz. So weaving yourself back into the threads of nature is the number one health cycle principle. And it's profound. Most of my chronic fatigue patients and patients with chronic disease right now, particularly in Canada, the number one treatment, relocate. And everybody freaks out. They say, what the hell? No, you can't get well in 51 degrees latitude without UVB and without sun and without grounding for 9 months of the year. It's not going to happen. Now, you can push biochemical pathways, but you need physics, you need sun. You need photons of light to turn on your battery in your body, because in your mitochondria, You got the outer cell membrane, you got the inner cell membrane. On the inner cell membrane, you've got this electron transport chain, which transports electrons to make energy. And that's controlled by a water barrier called easy water, which is the fourth phase of water. And that water has its charge separation between a positive and negative charge, just like a car battery. You know, when your car battery runs out of water, your car don't start. You're the same. You are literally a battery. And that water that's there needs to be, you need to be well hydrated with the right kind of water, the right kind of minerals, and you need to take away non-native EMFs because non-native EMFs dehydrate that water. And it's that water and that charge separation which allows energy to be produced. So you've got to get out in the sun, you've got to ground, and you've got to hydrate. Those are some of the big principles. And then other health cycle principles, food. Food's 30% of energy. And the food that we recommend mostly now is Paleolithic, ketogenic, local, seasonal, grass-fed, grass-finished, organic food. That seems to be the diet that is most helpful to reestablishing mitochondrial efficiency. So diet is hugely important, you know. So those are some of the health cycle principles that we have. There's many more. I've got like 20 of them. But those are the two that are very important. Yeah.
Yeah, and I imagine it's a bit of a balancing act trying to find that space or that way of living your life that is having as many of these lifestyle factors as possible while also not making yourself crazy with stress because you missed your midday sun or your diet wasn't perfect today. So,
Yeah, I
do
did a
you
blog on
find what
that.
people?
I did an Instagram post about a week ago with saying biohacking neurosis in a lab coat or something. I forget the exact word. Yeah, if you get too into biohacking and doing all these things, you can become neurotically quite, quite quite stressed. You're quite right.
Yeah, and some of us with these, type A type personalities or just that really go at things hard can turn anything healthy into something unhealthy.
No
You'll have
question.
99% organic, amazing food, and you have that one speck that's not. You're like, I failed. I'm never going to get better.
Yeah, it's very much like that. And one has to caution against that,
Oh,
That's why the therapeutic relationship between the healthcare provider and the patient becomes crucially important. You don't shame people, you don't castigate, you just listen. And
yeah.
then if people want to get better, there's a couple of caveats. Number one, they have to raise health to one of their highest values. They have to make getting better their highest value or second highest value. If they have it as number 3 or 4, like some people, career, making money, education, relationships, um, you know, intellectual pursuits may be of higher value. But if you don't raise up health and health practices as being your highest value, you will often default and you'll have more chaos in your health. You'll have more order in what you value the most, like going to work and earning money, but you may have more chaos in what you don't prioritize, which is your health. So we do need people to really be honest with themselves. If they want to get healthy, they have to raise health up as their highest value.
Yeah, no, I was just thinking that was one of the really amazing things that I got from being a patient of yours was you had one of the many, many things, but you were the first doctor I saw that showed me that my role in this was significant. I wasn't going to be sitting back while recovery was done to me through pills or surgery. Like I not that I had to own this, but I got to own it. Like you have the power to change this and trust your instincts and, follow your gut and take charge of this. And
No
that hadn't
question.
occurred to me until I met you.
Yeah. Yeah, we
That's not
have a
my job.
yeah, there's a observation. If you know that I work in layers and levels, so level one's toxicology, level two's biochemistry and structure, level three is electromagnetics, the brain, the autonomic nervous system, the central nervous system, and man-made EMFs. Level four is emotional trauma. That's a huge role. Level five is the belief systems that the patient carries and the internal dialogue and the self-talk. Level six is to do with the families they're born into and what stage of life they're in and the unconscious and all that. And level seven is the spiritual connection to the one mind. Now, some people at level 5, they are highly defended because they're too traumatized often. They don't trust. Or they're highly resistant. They've been let down too often and they just can't, they can't enter into a new paradigm. Or they have a trait called projection of will, which is, I'm going to do nothing. You're going to do everything. And if I don't get better, I'm going to blame you. That's not a good equation. It doesn't work. It's very, very stressful. And
I love that. It's so true.
it's so stressful. And then when you're sitting there behind the desk and you're going through your checklist, well, how's this symptom? And how's that symptom? No better. How's this? No better. How's this symptom? No better. How's this? No better. Well, okay, let's see it. Nothing's better. Tell me what you've done with your diet. Well, I didn't change my diet. What have you done in terms of supplements? I couldn't afford them. What are you doing in terms of your mind-body relationship? Have you started primal trust or one of these things to look at your trauma? No, I already did it. I've already been to a therapist, didn't work. And all this, how are you doing? Where's your cell phone at night? Is it still next to your bed? Yeah, well, I need it because my children might call me in the middle of the night. And then you just go, okay, okay, then you've got to try and find an entry back into trying to get that person to take responsibility for their transformation. Some people are really so sick they can't mobilize the healer within, they just can't. And then it becomes a very difficult relationship. And you do your best, but sometimes you fail,
Yeah, and I think sometimes there's a learned helplessness. I just think, like with my mother, had chronic fatigue syndrome as well. And she tried so many things for so many years and got her hopes up so many times.
Yeah.
And then I saw in the end, she got to a place where she wasn't willing to put any effort. She'd given up.
It does happen. Yeah, it happens. Yeah. And there's also, and it's unfortunate, and it's not a blaming dynamic, but there is this sort of perpetrator victim consciousness that if that's center stage, man, that's an immutable dynamic to break, Yeah. If the person doesn't activate the healer within, but with intent and self-advocacy and the desire, your cells literally eavesdrop on every thought you have, And if you're in a self-defeating place and you've exhausted your options and you've been through and you've got medical PTSD, which is quite common, your mom may have just been, too many opinions, too many trials, who knows what the dynamic was. But if they've got those dynamics and if they don't activate the healer with intent, by finding a roadmap that makes sense, they will often end up in that position of we could call it learned helplessness, but it's just they've just traumatized and they just can't mount a new response. It's exhausted.
Yeah, that sounds exactly right.
It does happen, absolutely. And it's unfortunate. It does happen though. But then you get other people who are also not well, and then they're very, because of patient advocacy, people are really researching a lot. Now with ChatGPT, it's ubiquitous. And then you bring your clinical experience to the dynamic, and they will, through their chat groups or their support groups or their ChatGPT, they'll reject everything you say. Yeah. And then you're sitting, so how would you like me to proceed? And then it's also on the other side, patients are some patients are extraordinarily informed and insightful. And so it's this very, there's two dynamics that doctors can have when they enter into a relationship with complex patients. You can be doctor as hero or doctor as healer. Doctor as hero is, I'm going to impose all my knowledge on you and not listen too much about what you have to say. Doctor as healer is, I'm aware of the wounded part in myself and I'm relating to that part of you, but I'm also aware of the healthy part in me, and I'm also going to relate to the healthy part in you. And we're going to work this out together without victim-perpetrator consciousness. If you can establish that dynamic, and in a very informed patient, you can go far. And sometimes I have people come to me with all sorts of ideas, and I go, I haven't heard that. And I go Google it. Oh, that was not a bad idea. You can't know everything. It's complex. The world is extremely complex right now.
Oh, you're even more brilliant and amazing that I remember. I'm just thinking for people watching who've been watching my channel for a while, just picture this was my doctor at the beginning, 15 years ago, when no one knew anything about anything, it felt like. And these were the conversations I was getting to have with you because our appointments were long and you listened and talked. And it was just, I remember because I was living in Edmonton, so it was a 3-hour drive. And I think I only came in maybe once every couple of months. My husband would, now ex-husband, would drive me in. And that, it was just a mental lift after those appointments because I knew I'd come home and I'd be re-energized to keep
Yeah,
going for a little while longer.
yeah.
It's,
And
yeah,
people
you're,
people not only need, that old Borges's polyvagal theory of collapse versus ventral vagal. I don't know if your audience knows the autonomic nervous system. Um, you've got your fight flight response, and then you've got your parasympathetic, which has got two branches, the dorsal vagus and the ventral vagus. The ventral vagus is that part that you initiate with your mother, when you're born and you come out and the gleam in your mother's eye. And then the child sort of bonds to that. They see that and they constantly looking to be seen and heard and validated by the mother. And every, the first from 6 to 12 months, they look every 8 seconds for validation because the mother is the external um, context of reality and survival. Without mother, I'm dead. So they're constantly looking to the mother, and the mother looks back, and there's this, you only have to be 30% present. You don't have to be perfect. And then the mother just looks at the child. Child looks at the mother, and then the right frontal lobe of the mother and the right frontal lobe of the child entrain. They get into limbic resonance. That helps over 25 years develop a sense of self. All you need to be done is seen and heard repeatedly over the first 25, 30 years while you're myelinating your prefrontal cortex, which is the part of your brain that's adult. They can inhibit your fight, flight, and your fears and your amygdala. So that's the same role a doctor has to take on, the healer, if they're going to engage in a patient who's been not seen, not heard by their mother, their father, or their doctor, and dismissed. If they don't develop ventral vagal resonance and trust over a period of time, and that trust can't be earned falsely. And I found the ingredients for establishing trust are A, the doctor as healer has to have quite a broad roadmap of what, diagnostically and therapeutically to hold when there's complex illness. And then it's this back and forth, communication as to what I did, what I didn't do, what worked, what didn't work, checking in, checking out, repeating labs, repeating. And then, and it takes up to a year to two to turn a complex patient around if you're going to be successful. It's not overnight. The mitochondria don't respond immediately to interventions, and you've got to also treat in a hierarchy of order. There's certain things you do before other things. Like people come in, they go, oh, I got mold illness, and then they get put on binders. First visit to a functional medicine or somebody doctor, and there's no understanding of the complexity of the mind-body system, the fact that binders deplete the person of essential lipids, and those lipids are essential to establish cell membrane integrity. So people often rush in to treat because everybody wants to get better immediately. That's human nature, no problem with that. But if you hold a very broad roadmap and you go, this is not, you're going to remove toxic load, you're going to practice health cycle principles, and we're going to put into your body new signaling molecules to reestablish your biochemistry the way it should be. This is going to take months. And you're going to meet up with biological resistance because your body's not used to this. So you're going to have symptoms in the beginning, but you've got to hold the space for that person for long periods while they sort of rehabilitate their signaling molecules back into some sort of safety and trust, and where you can tolerate your own tissues. If you look at the cell danger response, the first phase is inflammation, the second is repair, and the third is reestablishing communication so that your organs start to talk and function properly. That process can take up to a year, slow but steady.
Yeah, you're talking about something, I think, in far more technical terms than they normally talk about here. But so since people listening, many of you probably know this already, but Dr. Hoffman, you probably don't. But so when I saw that I was finally past chronic fatigue syndrome, and I hadn't really heard of many people that had done that. Not that they didn't exist, but when I was Googling it, I was just seeing doom and gloom online saying, learn to live with it. You'll never get better. So I started this YouTube channel and I just started interviewing people. And I thought, I'm going to find maybe 5 people because no one's recovering. But now, fast forward, I've interviewed 230 some people so far and counting. And we have an 8-month wait list or so to get on there's so many people that are recovering. So my goal is just, I don't cherry pick. I just want to hear your story. What worked for you? Right. And there are consistent themes that come up. And one of them is around the autonomic nervous system and around being stuck in that chronic sympathetic nervous system state.
Well, there's the sympathetic state, and then there's the dorsal vagal, which is the shutdown. I want to die.
Yeah.
I'm giving up. I'm a possum. I'm going to play dead. I can't take it anymore. So the sympathetic is actually better than the dorsal vagal shutdown, which is most chronic fatigue patients are in dorsal vagal shutdown, and they oscillate to sympathetic. They go back and forth. They feel hopeless. Then they get a bit of energy. Then they're in stress mode. So sorry, I don't mean, but that's a very common thing. And I use heart rate variability to show that. And then I use QEEGs to look at brain waves to show that. So I give people visual, this is what your autonomic nervous system is up to. And then I have these charts. I show them, here's coherence. Here's where you're going back and forth normally between stress and relaxation. Here's sympathetic overdrive. Here's collapse. And we hold up a diagram. There's diagrams in the world of somatic experiencing. They have diagrams of these. And what we're going to try and teach you is a window of tolerance so that you can tolerate more adversity and more complexity without going into fight, flight, and into dorsal vagal. And so one of the primary interventions of the work I do with complex patients is teaching them self-regulation. Number one. Well, health cycle first, next self-regulation. And I use neurobiofeedback, meditation techniques, somatic experiencing. There's a program out there called Primal Trust that a lot of people love because it helps regulate their stress responses and their trauma. And then the next third is POTS. I don't know if any of your patients have POTS, but dysautonomia due to, it's, if you don't treat POTS right after health cycle and self-regulation, you can't go further. People with POTS won't repair until they get their POTS under control. And then the next is the mast cell flares that everybody seems to have. And then you go into treating hormones. Then you go treat the cell membrane. And then you do all the rest, the mold, the Lyme, the SIBO, everybody does all these things. But if you go straight in and treat mold and Lyme and SIBO, the first appointment, not the right sequence. No, in my experience.
Yeah, Primal Trust, I've interviewed the one by Dr. Kat King. I've had her here on the channel and some people that have gone through her program. Yeah,
that one, there was the DNRS, there's the Gupta program, there's a few. Mm-hmm. But the ones that all my patients taught me about Primal Trust 5 years ago, they said, no DNRS, no Gupta. This Primal Trust resonates. And then more people did it, and now that Primal Trust crew, they have the capacity to do somatic experiencing and Primal Trust simultaneously. So SE's Peter Levine's work with trauma, right? Mm-hmm. So they do Primal Trust and SE work, and that's been a game changer, along with neurobiofeedback. Huge. Yeah. Some people just neurobiofeedback's turned them around.
Yeah, it's incredible. There are a lot of programs out there today, and I've interviewed Ashok Gupta from the Gupta program multiple times, and people who have found his program effective. There's just so many. There's ANS Rewire, there's CFS Recovery.
That's right.
I have a self-study brain training course. There's lots of options out there, which is great. It can be overwhelming also, because I was like, oh my goodness, how do I vet these? Where do I start?
Well, the way I used to approach it was I used to, take the history and see what their symptom complexes were, but then I'd measure them objectively through heart rate variability and QEEGs. I could see, you can look at a person's brain map electrically, and you can you can almost give a biographical explanation of what they're experiencing. You can just see what's going on in their brainwaves. So between the autonomic nervous system and their brainwaves, you can literally write a biography. And then you start to train that. But you've got objective data as to where it's at, So I use objective data, what I did when I had my clinic, and then we train them appropriately. And those change. People, once they start to cool off their amygdala, once they create a window of tolerance, once they get less reactive, once they stop reacting to everything and their mast cells are stabilized, they start to build inherent trust. Their bodies develop trust. Their doubt and also develops, they develop trust in themselves. I can try this and not have to go to the ER to get IV shots of prednisone.
Quick interruption. If you're working on your recovery from chronic fatigue syndrome or long COVID and know or strongly suspect that brain retraining and nervous system regulation will be a key part of your recovery process and you'd like to learn more about this, you can join the completely free 5-day brain training course linked in this video's description. No credit card required, no strings attached, just key information and strategies delivered straight to your inbox to help propel your journey forward. You can use the link pinned in the comments below and also in this video's description to sign up. So many great concrete things here. I'm thinking for people listening or watching, and they're like, okay, where do I start? If they're just at the beginning of their journey, they're like, that was a lot of information. I feel a little bit not sure where to go from here. What would you recommend?
Well, I can only sort of communicate what I do to help people, and that's usually after a 2.5-hour history taking. I determine where in the system are they the most vulnerable, right? And then from that I do a whole diagnostic workup, and based on the diagnostic workup, I then initiate what we call salutogenesis treatment protocols. But before that, I reestablish self-regulation and health cycle principles. And the health cycle principles, I give people handouts. And if you go, there's a handout. If you go to my 40-page handout, but I go to page 24, health cycle. Relocate from northern latitude to southern tropical. If you can't relocate out of inner city, go to rural, because rural's got less EMFs. If you can't relocate, redesign the interior of your home and get yourself a building biologist. Best person on your team, besides a nuca-chiropractor and a nutritionist. A building biologist will assess your home for non-native EMFs, because non-native EMFs are mitochondrial toxins. 15 mechanisms of how they destroy mitochondria. Really important that people get this piece, very well established and really research it. There's an electrical engineer in Calgary called Mitch Marchand. He goes into all my chronically sick people's homes and looks at electrical fields, magnetic fields, EMFs, and dirty electricity, and makes sure the home is safe. So relocate south, relocate rural, redesign your home. Number one. Number two, practice circadian biology principles. Look up circadian biology principles. Get up with the early morning sun. Get yourself a suntan in the spring and summer. Don't avoid UVB light. Don't burn. I'm not saying you burn, but you get brown, And then at night, use red lamps in your home, not overhead light, LED lights, and use blue light blocking glasses to block TV. And then put your phone away 2 hours before bed and watch your exposure to computers and cell phones. I mean, if you look at my cell phone here, it's hardwired and it's turned off. So I can get everything except phone calls. I can get WhatsApp and I can look at Instagram or whatever, but I'm not getting bombarded by cellular data and Bluetooth and all the rest of it. This is a very big toxin. People don't really know about it as much as they should. So circadian biology, grounding we mentioned, hydration. Hydration, not just drinking anything. You got to drink, if you don't have access to a spring aqua filter, which is $6,000, which nobody does, but if that's the best filter, then you got to get glacial water or spring water. and you got to remineralize it, and you got to hydrate, you know, and you got to build up this easy water. And then breathing. I don't know if your patients or your clientele are very hip to the whole nostril breathing, diaphragmatic breathing, slow breathing, mouth taping. Huge. There's new evidence that people who mouth breathe have 30% increased cognitive decline, 30% higher than it's huge, you know. And I'm aware of it because I was more of a mouth breather than I thought. So I took a course by Erwan LeCorre on breath holding and breath work. And it's powerful. So breath work is important. Then cold thermogenesis, cold plunging, not ice plunging, not ice plunge. It's too much. It's too hectic. But I've got the Bow River here. I just go swim at 16 degrees centigrade every day once the ice melted. So ice plunging or cold showers. Then the next thing would be photobiomodulation. People can get the photobiomodulation devices. Red light therapy, huge, huge to restore mitochondrial efficiency. So those are some of the things people can do at very little cost. And then I get into self-regulation, self-referral, understanding your family dynamics, inherited trauma. That's one of the most beautiful bits of work people can ever do, is understand how, why, at this moment in time, was there any inherited or early developmental trauma that contributed towards their symptom expression? Because in this world, we know that symptoms are teleological. They point towards what you're not looking at. So if you use symptoms as entry points into a deeper inquiry, so I teach people how to listen to their cells. I say, sit quietly, go into your body, find where you hurt the most, ask that part of your body, what is it you want me to know? You don't have to keep showing up. I'm listening. And then you listen, literally listen to your body. And, there's that book, Your Body Keeps the Score, by Bessel van der Kolk. You literally listen to dreams and synchronicity and things like that, and things show up. You'd be shocked. People, when they start listening to their body and asking their body to guide them, the body guides them. Most people. So then it's self-referral, family systems. Then a lot of people need cognitive retraining. They have certain belief systems that are highly stressful, or they infatuate with idealisms, and they resent, things that are challenging. And I use a Demartini method to reconstruct people's mental fields, to try to get them to see that in every challenge there's a benefit, to every support there's a downside, and get them to reframe their mental field into a more advanced set of consciousness, not so defended and victim perpetrator. Try and move through that, So I use the Demartini method for that. It's a very potent technique. And then, sleep, of course, reestablishing sleep is a whole subject that can go on for days. And then diet. The diet is the local, seasonal, following the leptin prescription, eating your biggest meal of protein and fat in the morning, 2 meals a day, 3 if you have to, and then no eating after 6 o'clock. And then letting your body go into autophagy and mitophagy and sort of clean out the debris from the day. So just sound eating. But I use the nutritionist for that, who guides people through that. And we take people's diets and we do very seriously look at them. And we put them through a chronometer, and we look at their macro and micronutrients. And then we look at their labs and we see, are they protein deficient, mineral deficient? And we try and change their diet accordingly. And then exercise, stretching. I use an app called Bend. It's 20 stretches. And then we work at structural issues. A lot of people have to get sort of structural, fascial restructuring, like through nuclear chiropractor or osteopathy. And then we look at dentistry. And then we look at making sure people are cleaning up their homes of all the pollutants and toxins and exposures, which is a whole subject on itself. Yeah.
This is just a good recipe for life. I think all people should go through this assessment, whether they're feeling unwell or not. It's just...
It is for the well. So if you look at my model that I've just reintroduced, I'm teaching something called the new medical curriculum, trying to rephrase the N squared, D squared model. Because functional medicine's gone down that same N squared, D squared. Oh, you got this, take the supplement. Instead of, oh, you got that, take a drug. So changing the new paradigm In the new paradigm, we have a much more expanded model of diagnostics with the whole person, you know. And then we also talk about the landscape not only of disease but also wellness, because the person who presents with complex illness, there's a well component to them. There's something quite functional about them, and you need to know that piece. You need to get that functional piece to speak to the person, the piece that's not so functional. If people over-identify with their illness, it can be catastrophic and overwhelming. So you need to help them recalibrate their wellness, the parts of their personality that aren't symptomatic or heavy labels. And then the two other pieces in the new paradigm, putting the mitochondria at the center of all disease presentation, and then changing from biochemistry and food more to physics, light, water, and magnetism. Those are the four pillars of the new medical curriculum for people to embrace, you know.
This is absolutely incredible. I appreciate this so much. I have learned so much from just this relatively short discussion, and we know it's very few doctors out there who are trained this way. So it's incredible. I really appreciate you being here. This is a really great, like, full circle moment for me. Just wonderful to see you. I just want to reach through and give you a hug, but also I remembered how brilliant you were, but not even fully. Like, this is incredible. Just thank you. Thank you for taking the time to do this today, Dr. Hoffman.
No, it's been a pleasure. And I've done two free webinars in the last 2 months, one on mitochondrial illness and the other on the need for the new medical curriculum. So I don't know how to do this. My staff can maybe let your people know how they can access those free materials, because I go into more detail than what we discussed today.
Okay, we will get those. They will be in the video description.
Yeah.
So by the time people are watching this, you will have all that in front of you. That's absolutely incredible. I'm thinking too, I'm going to link here because it can be frustrating because it feels like none of the physicians out there get it when we're out there in the world with these conditions, but there are so many more these days that do. And I've been fortunate enough to get to interview a lot of them here. So I'm going to just link a playlist that is just all physicians who are up to speed and doing great work with patients, and you don't have to get to their office. That's the great thing with the internet.
You can do online virtual consulting.
Yeah.
I do teach a more advanced 10-week series, two hours every second week on the new medical curriculum. But that's for practitioners and self-advocacy patients who've really they've really gone down 500 rabbit holes, and they want more. They're looking to me for my experience of how to integrate all the complexity and all the rabbit holes into how do you actually address complexity?
Yeah. Incredible. Wonderful. Thank you so much. This has been a real treat for me, and I know really helpful I'm sure, for the people watching. So wonderful having you here. Thank you so much. Thank you to everyone who's watching, and hope to see you in one of these next interviews linked up here.